Is working? Hello, everyone. Um, this is Dr. Thomas Chacko. I'm an allergist in the North Atlanta area, and this is probably my second or third Facebook Live, but I wanted to open it up um, to talk a little bit more about, specifically to do a talk about food, oral immunotherapy or food desensitization. It's something that's a fairly big part of my practice. I know a lot of people have questions for me, so I want to try to answer some of those questions um, now, especially now um, with COVID going on and some of the treatments. So the first question people have asked me often is, what is food allergy desensitization? What that is. So basically, it's what we do is we give small amounts of food or the things that people may be allergic to, and allow their body to tolerate it. So, for example, for peanut, what we do, we give small amounts of peanut over time. It starts with peanut flour, small amounts of peanut flour, and eventually becomes more and more and more, and then eventually it is becomes a peanut or two peanuts or even peanut M&Ms. This is a way to gradually allow the body to tolerate peanuts. The goal of this is not for someone to eat peanuts liberally, for example, but the goal is that if you were to have an accident, your body can tolerate a small amount. Um, I do, in regards to the oral immunotherapy, the abbreviation for that is OIT. In regards to that, um, we probably do the most with peanut because that's the most common. And then secondary tree nuts. And then third, after that, it's usually peanuts and tree nuts, and we do have milk and egg as well. Um, I do have a question that says, can this treatment be done with other foods outside of peanuts? And the answer is yes. We do. The most common foods that are done are peanuts and tree nuts. But my favorite actually that I like to do the most is milk. A lot of kids, not a lot, most children do outgrow milk allergy. But if they have it by the age of 4 or 5, the probability of them outgrowing it is not very high. So if a kid's allergic to milk at the age of 4 or 5 and they're not going to outgrow it, it's pretty difficult because now they can't go have ice cream, cheese, even things made with milk like cakes and stuff they may not be able to eat. So that's one that we've done had a lot of great success on, where we give them small amounts of milk, and eventually their treatment is actually eating a glass or drinking a glass of milk or some serving of dairy a day to allow their body to tolerate it. So now then, after they after they're drinking or having that one serving, they can now go out and eat pizza, eat and kind of eat like everyone else. So that's a long answer. Is there peanuts are probably the most common, but we do many other foods as well. Tree nuts, milk and egg being the other common ones we do. Um, how long? And so another question I see is, how long does the process take? Um, typically it depends on the food and how allergic someone may be. For example, the average person for a peanut, we could have them eating a peanut or two probably within 4 to 5 months, maybe earlier. Some people who are super sensitive, we have to go a little slower. Basically, we give them a small amount every 2 weeks and go up. But if they're super sensitive, we might not go up as fast. Um, for example, other foods like milk or egg, it depends on the dose, but that might take more like 4 to 6 months. Um, Egg might even take longer because that's a little bit more difficult to tolerate. So the process depends on the food, but you could say for the most common one, peanut, I would say about 4 to 6 months to tolerate a certain amount of peanut. Uh, and then uh, the other ones we've had are the biggest questions people also have are the side effects. Generally, it's just itchiness in the mouth, um, itchiness in the mouth, maybe some mild stomach upset. But most people who do the desensitization, most people, especially for peanuts and tree nuts as well, but especially for peanuts, 85 to 90% of people go through it without issues. So if a patient, if it bothers you, if thinking about eating a peanut or those that bothers you and you're limiting some of your activities, um, I usually say with 85 to 90% certainty that if you come in my office within a few months, your child will have a peanut or two in our office and be fine. Well, we've done that a lot actually, and it's actually probably one of the most fun appointments we have. is when the child comes in and has a peanut, and usually the mom and dad are pretty emotional because they're nervous and they do well without any issues. We have so many people now doing the OIT, meaning the food desensitization, that we set up a separate day specifically for that, which is on, we typically do that on Tuesdays, with one of my nurse practitioners doing it. So we've had so many people doing it now that we almost have to have our own clinic to help accommodate all the patients doing it. So that's a good news that we have so much experience doing it, but it's just a matter of making sure we can accommodate all the patients who may need this treatment. Um, Other questions that I have are with COVID. Actually, this is a great question. With COVID going now, should you start or not? What are we doing and what are we not doing regarding this treatment? And that's a tricky question. The answer is up to you, and it depends on how much you've been social distancing or how are you. People have run the gamut on there on how aware how much they isolate or not. If it was my child, would I feel comfortable coming into our office and needing that therapy? I would say yes. Actually, now I think it's a good time potentially to do this treatment, especially on a Tuesday because we don't have many people doing it. They stay in a room. They kind of have their own room there. We're limiting some of our flow. Um, and also, school is out, vacation is out, no one's traveling. So this treatment can be time intensive. So it might be a good time now to get it done versus other times when school might be back in session or when you're traveling. So I think it's comfortable to come in and do it. I don't, and now we're having people come in now, but I wouldn't fault anyone if they're still staying home and only going out as needed and restricting themselves. I don't think that's a wrong answer either. But we are having a lot of people starting now, and I think it's a safe option to consider. The other thing is, I know once, hopefully, we all get back to a regular, whatever our regular will be, life gets busier, and just getting these cumbersome things might be harder to do. So, in regards to COVID, we are now having people come in, um, and we are doing the updosing, and I think we're doing it okay. But again, if that makes anyone nervous or they'd like to hold, we could always wait till afterwards. Um, Other questions that we have are there lab works or numbers that, and again, I'm just, for anyone else who might be tuning into this video, we're talking about desensitizations with food allergies. I'm focusing on peanuts because that's the most common, but again, we do very many, a lot of the other food allergic, um, um, a lot of the other food allergies as well, including milk and egg and a lot of the tree nuts. Um, but in regards to peanut, generally again it's well tolerated, and the question is, if what if my kid is really allergic and their numbers are super high, are they not a candidate? And I would answer that is not a major concern with me. Many of our patients have their IgE greater than 100. So I saw a patient yesterday coming to me from another allergist, asking about oral immunotherapy, but the peanut IgE is greater than 100. The AirH2, or the bad part of the peanut, was greater than 100, and moms thought these numbers are too high to be a candidate, and we have people doing that all the time. I feel fairly confident that child, he was like an 8-year-old boy, will come in and within a few months we'll have a peanut or two in my office, and I think they would be a very good candidate to do that. Mom right now, they don't go out, they don't eat Publix cakes or things like that may be made in a facility. So I think they would do very well on that treatment. Um, and so I think those are the people who I would consider that. Any other questions from anybody asking here? I see a few eyeballs. I see 19, but they might just be looking at me uh, hanging out. So the other things, let me see if I could see who are those 19 people. Am I able to see anything? Oh no, I can't see who's looking at us. But the other things I would say regarding the treatment is, now I've been doing it for about 4 to 5 years, and that a lot of the patients who have done the treatment, I don't see again. I was seeing a patient on Monday, and they were talking to me about someone they know, a friend of a friend, whose kid had gone under some treatment for oral immunotherapy, and then they just eat a few peanuts a day and they don't come back. And then I asked who the kid was, and then it was actually my own patient and who I know well actually. Um, but I haven't seen him in a year or two because he's done his treatment and they're on their way. So it's one medicine that you're not going to need to be on. You will have to be taking some amount of peanut routinely for some time, but it's not uh, it's not a lifelong medication in that it's just taking the food that you are allergic to keep your body at a desensitized state. Um, Trying to think any other the other questions that come up often. Let me see what questions that we have. Ooh. Uh, oh, I'm sorry. I see some questions coming in, but I didn't realize to scroll down. That is my fault. One person asked, "Can I mix?" And that I apologize. I didn't realize I have to scroll on the side. One of the questions is, "Can I mix this treatment with my current allergy medicines?" The answer is yes. You can totally mix this. You actually should maximize your allergy treatment based on. We want to make sure most of the patients with food allergies have allergic rhinitis and asthma. We want to make sure you take your regular medicines on that. Um, we want to make sure you're taking your regular medicines and taking your other allergy medicines while doing this treatment. Some people we don't put them on allergy shots prophylactically, but we make sure their asthma is good, their allergies are good, and well taken care of before we do this treatment. Brittany had asked, how successful is this treatment? Depending on the food, and it depends on what success is. But regarding the peanut, if many parents just hope that if their kid gets exposed to one or two peanuts, they're okay. Well, if you consider that success, it's like 90-95%. We can have them tolerating the peanuts without any issues. So I would say it depends on the food. Our milk has been very successful as well, but there are some foods that are more difficult, like egg. Egg is a tricky one. People have a harder time tolerating that. So it just depends. Um, oh wow, Dustin Skidmore just wrote, "My sons are almost done with egg." Uh, that's good to know, actually. Um, I was just saying that egg is a tough one. Egg's a tough one to do. So people who do tolerate the egg is that's a good one because egg is sometimes a difficult one to get through. Um, Another question people ask is, when should we perform a food challenge? That's a great question. Um, the problem, a lot of people come to me with either usually it's blood testing that's positive to various foods, but the false positive saying it's positive and not clinically relevant is pretty high with a lot of the blood work. So unless you've had a history of an immediate reaction to the food, um, or the blood work is really, really high, often the food challenge is the gold standard to know if you could tolerate it or not. We do food challenges all the time, all the time. Also, a lot of people who are allergic to milk or egg can eat it in the baked form. That's a big thing for kids with cookies and cakes. So we will do baked egg challenges all the time um, to see if you can eat it in different forms. Um, there is data that eating it within the baked or the baked product actually helps you to outgrow the milk or egg allergy. It helps your body to slowly see that. So that's something I've often seen people who come to me and they've been told they're allergic and to avoid these foods for years based on a false positive test. And so that's something you really want to make sure the history is conclusive. Someone has asked, what is the ultimate goal of the treatment? Um, that's very patient specific. It depends. I would say for milk, it's to be able to freely eat dairy without any issues, and we get to that. Usually for peanuts and tree nuts, the goal is that if you have an accidental exposure, nothing would happen. Um, so the goal usually is to have a certain amount of peanut or tree nut, possibly one or two peanuts, or actually even go up to higher. Many of my patients taking 5 grams of peanut, which is like about 5 or 6 peanut or 8 peanut M&Ms, and that's usually an amount that will well protect them from any accidents. But typically we don't go higher than that because most people don't want to eat more than that. So the goal of the treatment is patient specific and allowing the body to get a small certain amount of the food allergen without reacting. Another question I get is, how old does a child have to be to do this treatment? Um, we start the peanut as young as 9 months to a year. There's newer data that the earlier you start, specifically with peanut, the better it is, or the easier it's tolerated. So we start with like peanut flour and eventually give them Bamba, which is peanut puffs, like peanut Cheetos. So now we've done down to 9 months to 9 months to a year for the peanut patient, the peanut allergic patient who don't look like they would outgrow it. And the newer data is making it seem that there's this money window between 6 months and 3 years where the IG or the peanut allergy goes up. And so if you get it earlier, you may be able to decrease that response. So for peanut, we start earlier. For some other foods like milk or egg, we wait at least till 4 or 5 because some will naturally outgrow it. So we want to make sure give the body the chance to naturally outgrow it before starting it. Um, oh, what happens if you skip a treatment? Um, so it's generally fine if you skip a day or two. That's probably not a big deal. The bigger issue is if you skip like 3 or 4 or 5 days, something like that, then we may have to go down on the dose. We want to have the body constantly seeing or continuously seeing some of the food that they're allergic to develop that tolerance. So a day or two here and there is probably not a big deal, but if you skip for like multiple days or a week or so, then we have to go down. And so, hey Shelly, how are you? So let me read what you wrote. My son was airborne. Oh yeah, uh, yeah. We know these guys well, and so now they're doing well. So you can see one of my patients is having mentioning that now eating five. Oh, grab five! Wow, eating 5 teaspoons of peanut butter. That's a lot. That's actually pretty impressive because most kids don't like to eat that much. That's pretty good. So, but my point is, we've had a lot of success with doing this. The peanut's the fun one because I think, actually, I like milk and peanut, but peanut I think makes people very nervous. So I think gives people a lot of peace of mind that they're able to then tolerate the peanut or peanut protein. So Katrina writes, so a food challenge is actually eating the food that you're allergic to. Uh, Katrina, yes and no. The food challenge is trying to see if you truly are if you are allergic to something. So if we know you're allergic to peanuts and you had peanuts and you vomit and has an issue, no, we wouldn't do a food challenge that. But there are a lot of people who have never had peanuts or they've eaten peanuts before, but now for some blood work they were told they were allergic to peanuts and they've avoided. But are they truly allergic or not? So the food challenge is actually the test to see if you're allergic or not, if the history does not tell you that. So if you've never had a certain food, but you have a blood work that says it's positive, we don't know if it's a real positive or not. So a food challenge will help to determine that or not. And then Chris has written, how long does treatment typically take effect, a positive effect? It's pretty quick in that the question is most people are worried about having a reaction to a certain amount of food. Well, the treatment is we're giving you this food and proving that you're not reacting. So you could almost say it's instantaneous because we're proving that you're able to tolerate a certain amount of the food without issues. So we'll give you a half a peanut in our office and watch you and make sure you're okay. Then we know if you were to be exposed outside to a half a peanut, theoretically you should be okay. So that's a longer answer to the treatment works pretty quickly. I have another question. What happens if you skip a treatment? I think that came up again. If you skip a treatment, you should be okay as long as you don't skip multiple days, like 3 or 4 days in a row. You should be okay. We've had people who have a GI bug or for numerous reasons they skipped it, and then we will manage you and tell you how to reintroduce the food. Usually we cut it down and then ask you to bring it back up to higher doses. I'm trying to look, making sure I'm going through this to see if I've answered every question that came up. I think I did. So, in conclusion, oral immunotherapy is, I think if your food allergies and the immediate type of reaction really bothers you and makes you worried, then I think this is something that you should consider. There's plenty of information to read about. You could go to my website, you can go to my Facebook page. They have plenty of stories within my Facebook page of my own patients and on my website. Uh, and then I think with that, I will end. Thank you for the questions. Thank you for checking us out. And Hope you guys stay safe. Thank you. How do I end the video?